Hi, my name is Dr. Brooke Kolisiak, and I am the owner at Legacy Physical Therapy. Really, I want to take a chance to help get some information out there for people about common questions we hear about here at our practice for core and pelvic health. Here at Legacy Physical Therapy, we specialize in pelvic health, and our mission is to help people restore their core and pelvic health without the needs for surgery or medications, and really give them conservative options. And so I thought, what better topic to start out on is talking about bladder health, because that's something that we talk about all the time, and there's a lot of misinformation out there for people. And so we want to clear up a few kind of misconceptions that people may have in order to promote better bladder health. Today, I want to give you 10 tips to improve your bladder health. And first and foremost, we're not designed to strain or push to empty our bladder. Women especially tend to be what I call power peers, and they go as quick as they can because they've got to get in, get out, and get on with their day. But forcing or pushing to urinate actually puts more strain through our pelvic floor and our bladder and stresses things out. And we are designed actually just to sit and relax and let the urine come out. Take a moment, sit down, and let the flow happen versus trying to strain or push. Number two, in order to keep your bladder happy, you need to drink more water, okay? Most people, especially if they are dealing with some bladder urgence or issues such as urgency, frequency, or leakage, actually try and limit their fluid to limit the amount of times that they have to go to the bathroom, or try to limit the opportunities that leakage happen. But unfortunately, when we limit fluid, it actually irritates the bladder rather than helps it. Concentrated urine is more irritated to the bladder, and so we want to make sure that we're getting plenty of fluids, primarily water, throughout the day to stay hydrated and keep the bladder happy. You can tell that you have about the right amount of fluids in there by looking at the color of your pee. Your pee should be a pale yellow, and if it's a dark yellow or even towards the brown side, that is definitely a sign that you are not taking in enough water and you need to get more in. Number three, sit down on the toilet. So who here is a hoverer? Okay, I know lots of friends who hover over the toilet because they're worried about germs or whatever else, but we are designed to sit down and relax to urinate. So that allows our pelvic floor muscles to relax and improves our ability to empty our bladder. So don't hover. If you're worried about germs, use some disposable toilet seat covers if you're out in public, but you're designed to sit down to pee. Number four, limit or avoid caffeine. Now, this can be a sad one for lots of people. Don't get me wrong, I like my cup of coffee in the morning, but caffeine is a bladder irritant and can cause increased urgency and frequency. So if you can eliminate caffeine, that's the first thing that I would recommend if you're dealing with urinary urgency and frequency. If you absolutely cannot cut it out, then for every cup of coffee that you take in, you should also have a cup or two of water to try and dilute that a little bit. Next tip for healthy bladder: when we are finished with urination or having a bowel movement, we want to be gentle, and that so when we're wiping, wipe front to back, but dabbing may be better, especially just on the urination side, because our tissue down there is delicate. We don't need to do lots of forceful wipes, especially on the urination side of it. So dab front to back after you're done, and that can help protect the delicate tissues down there. All right, next tip: don't ignore the urge to go. Okay, our bladder and brain communicate when our bladder is full, and it tells us that it's time to urinate. And this usually occurs every 2 to 4 hours. Listen to your bladder. Okay, when you feel that need to urinate and it's been around that 2-hour mark, then go. Don't just try and finish up that project and keep moving and keep going. We can train our bladder to hold more and more, but over time it's going to have more and more trouble doing that. So I work with a lot of nurses and teachers who throughout their careers end up holding their bladders for long periods of time. And then I start working with them when they're retired and in their 50s and 60s and dealing with some urgency and frequency issues because their bladder has gotten fed up with all that it's had to do over the years. Listen to your bladder. Don't ignore the urge. If it's been 2 hours, go to the bathroom. If it's been less than that, if you're going every hour or so, then we may need to look and see if something else is going on, because you should be able to go longer than that. Healthy bladder tip number 7, squeeze before you sneeze. So sometimes we have warning that a sneeze, a laugh, or a cough is coming on. And so we don't want to get caught off guard. And in order to make sure that no little bits of urine leak out during that situation, you want to maybe do a little squeeze of the pelvic floor muscles. Okay, this can help to minimize or eliminate those leaks or dribbles. So in order to contract the pelvic floor muscles, you want to think about trying to pucker around the anus or draw the vagina up and in. If you're having trouble doing this or not sure you're doing it right, this is a great opportunity to connect up with a pelvic physical therapist to figure out if you are doing this right, to make sure that you get the most out of that work. But we'll make sure that those muscles are on and ready to accept that extra pressure that's going to be happening from when a sneeze or a cough or a laugh happen. Once you are finished urinating, when you're on the toilet, what I want you to do is give a little rock side to side and front and back. What this does is kind of helps to kind of slosh things around in the bladder a little bit and help everything to kind of empty down a little bit more, just to make sure that we're getting a good empty. So do this instead of trying to push or strain to get that last little bit out. See if just doing a little bit of movement can make a difference with it. Don't rush, okay? Sit down, relax, and let your body do its thing, okay? Rushing can prevent you from completely emptying your bladder. So we want to take a moment. I've even had people go so far as to set a little like 1 or 2 minute timer, because it makes them slow down. Just take some deep breaths while you're in there and just make sure that you empty fully. We aren't designed to rush to pee. Well, that was my 10 tips for a healthy bladder. Thank you and have a great rest of your day.